Rachel, I want to bring something up that almost is a little embarrassing, but it is kind of a truth. The old adage is that doctors are not particularly good business people, you know? I have to say this has completely changed as we discuss menopause and the businesses that are being brought about to support this natural life transition. I've never seen so many people in the medical field, physicians and others, who are creating businesses because of things they've seen in their practice or because of things they've experienced personally. What do you say?
I love it. I mean, I have heard that adage that doctors don't make terribly good business people, but every day, whether it's menopause or menstrual health or you name it, fill in the blank, we see the intersection, like you, and in the flesh, of healthcare practitioners who feel like they are uniquely prepared, and in many ways they are, to come up with solutions. You know, one of the reasons it's so fun doing this with you is I bring the business side, and, I don't even play a doctor on TV, and you bring 30 years of practice and your work as an entrepreneur. And I just really think that mix is so critical. And as our guest today, Diane Bitner, who's the founder of Khyria, was talking, she brings the patient care piece and understanding what's broken in the system and a focus on research and data to support what she's observing. And she's partnered with someone who comes from the business side. So, it is a team effort. It really is a team effort.
Absolutely. This is what makes the world go around in gynecology and business.
Absolutely. And, I see all the time investors really excited now to invest in physicians. For years in biotech, it's been a thing. And now we're starting to see it in women's health, where the value of X decades of actual experience helping patients deal with some of the conditions that they're focused on is really, really valuable and worth investing behind.
Let's talk to Diane. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest tonight, Dr. Diane Bitner, who is the founder of Khyria, which is taking a very unique approach to the menopause journey. Welcome.
Thank you. Great to be here. Excited to share what we're doing.
Well, let's start with, what does Khyria mean and how did it translate into building a menopause business?
Sure. So Khyria means the female almighty in Greek. And one of my co-founders, Maria Arvanitidou, happens to be Greek, and she came up with the name. So it's awesome. And it's just been really serendipitous. As I've been working on learning how to better and better take care of women in menopause for the last 15 years. And at the same time, she in her own way was really focused on how she could help women age better, feel better. And with her deep experience in healthcare, as well as how to finance and build companies, we came together at the same time and started Khyria.
Terrific. So what is it?
So Khyria is a digital health program that helps women feel better and age as they want to. It's a system that allows women to track their symptoms, to understand why they feel what they feel, especially as they understand their phase of ovarian function and their habits. And then they're able to really develop and track in real time what they're doing, how they feel, and really understand what's going on in this phase of life.
And what are the action items that come out of learning all this information? I mean, we have Oura rings, we have Apple Watches, we have, Fitbits and whatnot. How is this data being, assimilated with our daily lives?
Sure. Well, I love this whole thing about autonomy, right? So it's like this natural progression. So way back in the day, maybe even just a generation ago, patients, women, men, were at the liberty of their physicians. Like, the doctor would say, take this medicine or get this test, and we would just do it. And then, the middle ground has been consumers were a bit more informed. We know more of our options. We might look harder to find a physician. There's transparency, but still we're kind of at the liberty of what the physician knows. And maybe like you and I know, Alyssa, that when maybe docs haven't had the time to be expertise or have expertise in menopause, then you're sort of at the expense of their level of education. What Khyria does differently is allows a woman to understand day to day what's going on, how she feels, what she feels, and then she can use that information to make choices about her lifestyle, maybe to then ask more about how I can feel better. And then, in the near future, to share this information with her provider who might not know about menopause or treatment options and say, look, this is what's going on. It might be safe for me to take hormones. Can we talk more about what my options are? So we want to make the consumer an informed consumer.
So but before you get to the informed consumer, you have to have informed doctors. So both of you, my esteemed co-host and our guest today, have taken the liberty and made the effort to get more educated around menopause and menopause treatment. Why is that? We hear all these horrible stories about, you spend 4 hours on nutrition in medical school, 4 hours on sexual pleasure. What's the number in menopause?
If you're lucky. If you're lucky,
right? Yeah.
So what was the catalyst for both of you, since you've devoted your lives to women's health, to get more educated?
Do you want to go first, Alyssa?
Yeah, I was going to bring this up anyway.
Sure.
As an OB-GYN, what happens in practice is that your practice kind of ages with you a little bit. So, you come out of residency, you're seeing tons of young girls who need birth or babies, they're going to college, you're delivering a gazillion babies, you're up all night, it's super exciting. Suddenly, you're sort of thrown into the post-reproductive or perimenopausal,
Right.
time zone, and then later on, the menopausal population. And I hate to say it, but many of us learn on the job because there really is no formal or extensive training in menopause during residency. I mean, some of us were lucky enough to have mentors. I certainly did, who were in the reproductive endocrinology field, who taught a lot about hormones and whatnot. But until you're really applying it to your patient care, it doesn't really click. So I think for me anyway, and Diane, I'd be so interested to see if you had a similar experience. And my patients are following my general age path. So.
Yeah, same thing. My patients were asking me questions I didn't know how to answer. And I always joke that us docs are like, we feel really uncomfortable if we can't answer questions. We like to fix stuff for people. And so, these charts were piling up on my desk. I didn't know what to do. So I went to my first women's health meeting. I'll never forget, in 2003. And I was just blown away about what is known, right? And, like you, I couldn't unknow it. I couldn't unsee it. And so when I knew that there was so much available to help women, even just on healthy lifestyle habits and the same tricks that help us age well, help us feel better, right? Even maybe reduce hot flashes. So anyways, I was able to bring that information back to my patients. And I remember sitting in the back of a NAMS meeting, the North American Menopause Society, thinking, how am I going to bring all this information back and keep the visits efficient and keep my, RVUs up? And so I wrote a clinical process that worked really well, one-to-one. It helped people feel better. That's what I was, published in the journal Menopause back in 2014. And it really was a cool way to help people feel better. And, that's what helped morph into what is now Khyria.
Can you take us through I don't know whether to say patient or consumer journey? User, exactly. When they sign on to Khyria. Tell us about it and also highlight the distinctions from so many of the other menopause type platforms that are out there.
Sure. Yeah, there's a lot exploding right now in the menopause space, which is so exciting, right? And, there's platforms like Genève and Electro that are looking at doing telehealth. What we want to do is to keep patients with their own providers. And so we want users to come on the Khyria platform and have Khyria be her daily digital companion. So Khyria's with her. When she wakes up in the morning, she can say, oh, I had hot flashes. Oh, look, I didn't sleep well. Oh, look, my blood sugar was off. And it can really help us make better decisions for the next day. So when a user comes onto Khyria, and right now we're in our beta test, so we would love people to join our beta test. So when women come on, they go to the website and they're able to fill out a simple questionnaire to figure out, are they in early perimenopause, late perimenopause, early menopause? Unless, of course, as you know, if she's had a hysterectomy or she's got an IUD, then it might be a little bit more, but still we put together what we can. And then as she comes onto the platform, she fills out number one, what is her goal? And so we drive everything for that goal. What is her most distressing symptom and what can we really help her work on first? And then she's able to track her symptoms. Now, as you and I know, there's lots of symptoms that have been attributed to menopause. And this is one distinction between other platforms is they have, there's lists of multiple symptoms. This summer, July of 2022, I published the validation of the menopause transition scale. So it's a 7-question scale that has been validated against the sexual desire screening test, the PHQ-9, which is, as you know, a depression score, the MENQUAL, and the GREEN, which are both validated symptom scores. But this is just really simple. 7 questions, 3 is good, 1 is bad, and it allows a user to quickly define her symptoms. And then she tracks her habits. So we've picked 7 lifestyle habits that really make a difference. And then she's given habits to focus on. So let's say her energy is low or she has more hot flashes. She's given to focus on sleep and water. And then once she completes the rings on these habits over a course of maybe a week or 2, then she's able to take on new habits that she wants to work on. And, what we want her to see is that as she does these habits, then her symptoms improve.
So here's today's hot flash. According to the AARP, only 20% of OB-GYN residency programs in the US offer any training in menopause.
So Alyssa has talked before, and we're huge fans of all the people building businesses in the menopause space. And we've had both the founder of Genev as well as the founders of Electra Health on and Lisa Health. So as far as we're concerned, all the conversation just helps women all together. What is the business model, though? How are you making money? You're tracking these areas, tracking progress.
Sure.
How do you keep the lights on and get investors interested?
Sure. Well, to this day, we've raised pre-seed funding and we're currently raising our seed round. But our model is essentially a B to C to B model. And so, of course, our end user is the woman going through this process, no matter if she's 35 or 65, but really focusing on that perimenopause, early menopause. So she's our end user, and that's what we focus on in terms of our user experience. But we want to reach her through channels. And so, initially reaching her through channels of my colleagues who, my goal is that it will help them be able to practice this, taking care of these patients easier and more efficient. But as we reach them through our colleagues and then further through, let's say, self-insured employers and payers, we really believe that as women feel better, they know their habits, it will help make, let's say, a more engaged workforce. It will help reduce total cost of care because now women are engaged in their healthy lifestyles. And as we're able to grow the product over time, we look at this really being a total platform for taking care of women. So again, B to C to B.
Okay, so where does the money change hands? That's what people, when they're listening, a lot of the entrepreneurs want to understand how you make money. So describe the flow of money. Is it subscription? Does the self-employed insurer pay for it? Do health plans pay for it?
So initially, certainly in this process, it's a subscription model. And again, what's really interesting, we all know the numbers. We know that there's 60 million women in menopause. We know that 6,000 a day enter. We know that of the women who are symptomatic and seeking care, they're spending on average $2,000 a year each out of pocket in direct costs. So if we have a subscription model that is a fraction of that, then we're able to provide these women real information to help them feel better. And so initially starting with a subscription model, and then of course, as we're able to move into the space of the payers or the self-insured employers, of course, potentially an upfront benefit like a PMPM per member per month benefit that we're able to really help all boats rise.
Interesting. I want to back up to something that has always sort of struck me as a practitioner, but also, having just attended the NAMS meeting, the North American Menopause Society, which was fascinating, of course.
Yes.
And that is these stages of menopause or stages of perimenopause, because when push comes to shove, even though we have, you're collecting data and we have, criteria to suggest where somebody is along their journey.
Sure.
It really is such a continuum. And I find it a little confusing to put things in boxes when really it's one long continuum.
Sure.
I mean this with loving kindness. What say you? Like, how does that resonate with you?
It is, but what I've learned through our consumer research, I have a poster at the International Menopause Society around this, is women want to know why they're feeling what they're feeling. And so if we can understand, or if we can explain more, let's say about a hot flash. So for example, on Khyria, like a lot of our platforms, we have a lot of curated content that we've written, our experts have written to explain why is she having a hot flash? Is it triggered because of poor sleep, high sugars, low sugars, stress? You and I learned so much about the thermostat this last week with our candy neurons and substance P. So as a woman knows more about her symptoms, be it early perimenopause or later, to me, that's one of the things that matters across this continuum, is that women know why they're feeling what they're feeling. The other thing, for example, you and I both know, again, weight loss. Women come into the office because they say, I'm doing the same thing I always did. Why am I gaining weight? And it's not as simple as food in, food out. It is, of course, is she sleep deprived? What has her muscle mass done? Is she eating sugar after 4? Is it that second glass of wine? So again, it's helping women put all this stuff together. So wherever they are in this continuum, they can be empowered and they can be these informed consumers to then decide, is lifestyle enough for me? Or do I want to add a therapeutic, such as hormone replacement therapy, such as what we know is coming down the pike, these candy neuron antagonists, right? So lots of exciting options in the future, but we want her to know more about what's going on. And as you and I know, it's the biggest risk factor for diabetes and heart disease and obesity and stroke and dementia. So how can we get her back into the healthcare system versus wait for her to have a hip fracture when she's 80?
Oh, God forbid. Yeah, that helps a lot.
Yes.
I know. And so many women have symptoms that just take them off guard.
Oh, yeah.
And early on in the scheme of this transition into menopause, people aren't necessarily expecting the symptoms and really sometimes wonder, what's going on with my cognition? Am I going crazy? Why am I sweating like this? And it's really a little bit of a disconnect between some of the triggers that obviously will be identified on your platform.
Well, it's so tough, as you and I know. We've got patients who are like, I had a patient just the other week of, she's an engineer. She works with all male engineers and she's going into work and she's so worried about having a hot flash that the hot flash is even worse, right? So it's like, it's just not fair. I want women to know what's happening, just like a woman knows, what to expect in getting her first period. She should know what's happening when she gets her first hot flash. Like, oh, okay, that's what that is. I got this. I know where to go. I know what to do. So it's just really an exciting time that we can help all women rise and not have to suffer.
Which is really so important. And we hear even more about not just reducing the suffering, but increasing real experiences in the workplace, productivity, ability to progress, reduced turnover, reduced absenteeism, and we obviously just now started to hear about companies who have added menopause to the list of women's concerns. I wouldn't call it a disease, very carefully wouldn't call it a disease at the stage of life, to really do with menopause what they've been doing for decades with fertility and maternal care benefits.
Exactly. I think it's just critical and it helps everyone. I love the paper by Sorrell and Portman back in 14 looking at the total cost of untreated symptoms to business and the millions of dollars, and that, women are having more visits in the ER, visits to their doctor, hard to measure absenteeism and presenteeism, right? But it's just critical that women are, supported, like you say, in infertility or maternity leave, whatever it is. It's good for business. And as you and I know, 10% of women leave the workforce during menopause when they're at their peak, their ability to perform. I don't know about you guys, but I feel like I'm ready to take on the world and I'm 56. I'm just getting started.
So I'm so curious because this is a good segue into something that I've been wondering. You are a very entrepreneurial physician. And I notice a lot of us in the OB-GYN and menopause space. What was the bug that got you? What was the drive or the fire that got you started with this? I mean, after all, we train to see patients, and many of our predecessors see patients until the day that they are done seeing patients, and then they're fully retired. So
Right.
What really got you going with this business?
Truly, I couldn't unknow it. See how, like I'll give talks to 500 women and I just see the whole crowd of women just like paying such attention to just even basic information about the stages of menopause, about habits that can make a difference, about truly the truth behind the research around hormone replacement therapy, for example. And women are just so hungry for this information. And, to be able to have a process of care, to be able to speak about this stuff and to really connect with women, it's just addicting in terms of I get to help women. I have a segment on local news TV every Wednesday morning. I mean, to be able to reach people and have women come up and say, you saved my marriage, to be able to talk about sexual health, to give me language, how to say, I'm struggling here. I need support. Just give me a hug. It's just really cool. And so now my mission is just how can I reach as many women as possible? So again, to meet Maria, my co-founder, with Lynn, my longtime business partner, who's a lawyer and healthcare executive, to have all three of us as this, badass triad of women wanting to transform women's health. It's just really fun. But, as I tell other women on the plane home, I had several women ask me about this that were just happened to be coming away from NAMS, like, where do I start? I'm like, this is not for the faint of heart. Just like, I don't know about you, I had people try to talk me out of med school, right? Like, don't do that. It's too hard. I wanted it so bad, I couldn't not do it. I took out a big loan to start this private practice where I still see patients half time. It's taking a big risk on, as you know, to start a new business. And
I feel you. I feel you.
Yeah, I just believe that we're doing the right thing. And, as a mentor taught me, if you take care of patients, money will follow. And that's what we're doing.
Fantastic. Well,
I can't not do it.
we can't wait to see your progress over time. And I know it's never an overnight situation. So I know it's a slow go, but it's fantastic. I can't wait to see Khyria on my Apple Watch and guide myself accordingly. So best of luck.
Yeah. And again, what's so exciting is that we have our app-based platform, but we're pulling in passive data as well. So as well as patients tracking their stuff, we're pulling in data from a smartwatch, from a continuous glucose monitor, and a smart scale, and really creating this digital phenotype of pulling it all together. So I'm excited for you to see it as well. And
I'm also happy for listeners to hear two such engaged menopause care providers, because as you said at the beginning, it is not common. And I've had the pleasure of talking to Alyssa. I've heard her talk to many people about the many basic things you can do to improve menopause. So I hope people listen to this and feel like, wow, there are lots of people out there who care about me going through this stage of life.
And sign up for the beta test. They'll learn even more about themselves.
Please,
so that's awesome.
Khyria.com. And for, employers out there, we're here to help, and we just want to help as many women as we can. And Rachel, without people like you with the business experience and the startup experience, like, there's a lot to what you do that I don't know. So again, having my co-founder Maria with her deep experience is just really exciting that we can, again, move forward together. We all need each other.
Absolutely.
Fantastic.
Absolutely.
Thank you so much for joining us.
My pleasure. Very exciting. Thanks for what you all do to empower women and lift up this business of the V.
It's our business. We're in the V business.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.